traffic light as a tool to understand prediabetes. Hello, I'm Dr. G.B.Sattur, senior physician and lifestyle expert with an experience of more than 40 years, including the first 6 years in the UK. Traffic light as a tool to understand prediabetes. Prediabetes corresponds to the yellow light. Prediabetes is a condition where your blood sugar levels are higher than normal but not high enough to be classified as diabetes. Prediabetes represents a critical health concern that impacts millions of people. In my opinion, this is the most pivotal stage. Here, one occupies the middle yellow zone and is waiting for the green light to appear to continue their journey. When one neglects lifestyle modifications, you shift to the red light, that is full-blown diabetes. Conversely, if one diligently adheres to lifestyle modification with military precision, they may remain in the yellow zone for years and, if lucky, return to the normal non-diabetic green zone. However, should one disregard lifestyle management and indulge in unhealthy eating habits like junk food and a sedentary lifestyle, they inevitably progress to the red zone or the red light, full-blown type 2 diabetes and its associated complications. Globally, the number of individuals diagnosed with diabetes is projected to escalate to 643 million by 2030 and 783 million by 2045. This alarming trend is advancing at a tsunami-like pace, particularly in India. Diabetes is represented by the red light here. In pre-diabetes, fasting plasma glucose is between 100 to 125 milligram per dl, which is deciliter. And the A1C is between 5.7% and 6.4%. All these blood levels are in accordance with the criteria of WHO, ADA, and RHSDI and API in India. The A1C test reflects the average blood glucose over the preceding 3 months, akin to calculating average rainfall at the conclusion of the rainy season. You say so much was average rainfall. In diabetes, A1C should ideally be around 7%. The red traffic light signifies full-blown diabetes type 2. Once one reaches this stage, it signifies a complete onset of diabetes with progression to complications if neglected. Of course, diabetes can be reversed with stringent lifestyle modifications, especially if the duration of diabetes is less than 5 years. You have type 2 diabetes if 1. Fasting plasma glucose or sugar in lay terms is 126 milligram per dl deciliter and above. Number 2, when we are unsure, we do an oral glucose tolerance test by giving oral glucose, OGTT. 3, random plasma glucose or blood glucose. This is a test where we take blood as you come to the hospital or clinic, and a level of more than 200 milligram in a person with classic symptoms of diabetes confirms diabetes type 2. 4th, hemoglobin A1C or HbA1c. So all in all, effective lifestyle management is essential to continue in the green zone. Yellow light in the middle zone to prevent a transition to the red zone or full-blown diabetes. Pre-diabetes or yellow light is an opportunity, not a sentence. Many of my patients have remained in the yellow zone for years and years, or even reverted to the green zones. All in all, one needs to be very cautious, know the values, know the numbers. Take care. Bye.